Let's talk about one of the biggest stories in medicine right now, GLP-1 agonists. You've probably heard the names, Wegovy, Zepbound. These drugs didn't just create a new treatment. They've completely upended how we think about treating obesity and even heart disease. It's a true revolution.
And that brings us right to the heart of the debate. On one side, you have this incredible, almost unbelievable promise, a 20% drop in the very things that are the biggest killers on the planet. But on the other side, well, there's a pretty scary list of serious warnings and potential side effects. So, how do you weigh that? How do you balance that equation?
So here's our game plan for today. We're going to start with why these drugs are such a breakthrough. Then we'll dive into the amazing benefits. After that, we have to talk about the risks. We'll see how all this plays out in the real world, and finally, we'll look at the tough calculation that doctors and patients face.
Okay, first up, what exactly makes these drugs such a massive game changer?
So what are they? They're a class of drugs called GLP-1 receptor agonists. Now, in plain English, they basically mimic a hormone your body already makes. This hormone does two really important things. It tells your brain you're full, and it helps your body control blood sugar. They were originally for diabetes, but their powerful impact on weight and heart health has launched them into a whole different stratosphere.
All right, let's get into the benefits, because they are truly monumental. This is the core of the argument for why these drugs should be widely used.
I want you to just look at this number for a second. 20%. A landmark study called the SELECT trial found that these drugs cut the risk of a heart attack, a stroke, or dying from heart disease by a full 20%. And let's be clear, this isn't just a happy side effect of losing weight. This appears to be a direct protective shield against the #1 killer in the world. It's incredible.
And then, of course, there's the weight loss itself, which is, honestly, it's just staggering. We're talking about an average of nearly 15% with some drugs, and in certain trials, it's gone as high as 24.3%. For a medication to do that, I mean, that's completely unprecedented. We've just never had a tool this powerful before.
And the good news just keeps rolling in. It's not just about the number on the scale. When you see weight loss like this, it kicks off this amazing cascade of other health benefits. Your triglycerides go down, your cholesterol profile looks better, your blood pressure improves. It's not just weight loss. It's like a total metabolic reset for your entire body.
But, and you knew there was a but coming, that incredible upside comes with an equally serious downside. So let's flip the coin and look at the case for being extremely careful.
So here's the catch. To get that amazing 20% heart benefit, you have to stay on the drug for years, maybe for life. The problem, a lot of people just can't. In that same big trial, almost 17% of people taking the drug had to stop. That's more than double the rate of people who stopped taking a placebo. The main reason? Gastrointestinal side effects.
And we are not just talking about an upset stomach here. The official list of warnings is pretty sobering. There's acute pancreatitis, which can be life-threatening, gallbladder disease, a potential risk for certain thyroid tumors, and a big one, acute kidney injury. These aren't minor issues. They require serious screening and very close monitoring.
And that really brings us to the bottom line on risk. This is not a simple prescription you can just write and forget about. As one expert put it, the sheer complexity demands careful, expert assessment for every single patient.
Okay, so we've talked about the benefits and risks in theory. Now let's see what happens when these risks actually become a reality for people out in the real world.
This right here is a perfect example of how a manageable side effect can spiral into a true medical emergency. So it starts with things like nausea and vomiting. But remember, the drug works by slowing down your stomach. That makes it incredibly hard to drink enough fluids to rehydrate yourself. And that can lead to severe fluid loss, which can directly cause acute kidney injury. We're talking about a situation that could land you on dialysis. It's a critical safety issue.
And there are other trade-offs that are now coming to light, ones we didn't see coming. While losing a lot of weight is fantastic, there's growing evidence it might, unfortunately, come with a higher risk of bone fractures, especially for certain people.
Take a look at this. For patients over 75 years old, the rate of hip fractures was more than double in the group taking the drug compared to the placebo group. Now, this is still being investigated, but it's a huge red flag. It suggests that for older patients, we might need to be much more careful, maybe even doing things like bone scans before starting them on these meds.
Here's another one most of us would never think about, surgery. That delayed stomach emptying we keep talking about, it becomes a huge problem if you need anesthesia. It seriously increases the risk that you could aspirate food into your lungs, which is incredibly dangerous.
It's such a big deal that anesthesiologists now recommend you stop taking the drug weeks before planned surgery. It just adds another layer of complexity.
So, after all that, how does anyone make a decision? Well, it all comes down to this final, really difficult calculation. It's a constant balancing act.
It really all boils down to this, doesn't it? On one side, you have a profound, life-saving benefit, slashing your risk of heart attack and stroke, plus weight loss that can literally change your entire life. And on the other, you have a complicated web of serious risks that demand constant attention from both the doctor and you, the patient.
And I think this is the most important takeaway of all. The goal here isn't to find a magic pill that eliminates all risk. That's just not realistic. The goal is to manage that risk meticulously, and that takes an expert who knows what they're doing and a real partnership with the patient to make sure the incredible benefit always outweighs the potential harm.
And that leaves all of us with the big question, the one that modern medicine is going to be grappling with for years to come. As these revolutionary drugs become more and more common, how do we balance a guaranteed, life-changing benefit against a significant and very complex risk? There's no easy answer, but it's a conversation we're going to be having for a long, long time.